Ladies and gentlemen, dear members of the Board of Directors of KCE, dear colleagues, dear friends, what to do when a research institute as KCE is celebrating its 10th anniversary? I'm sure each of you can imagine a few scenarios of how to organize such a celebration. We could have produced an anniversary book where we look back on what was realized in these last 10 years. Or organize a symposium looking back at the highlights of our production. More than 200 reports meanwhile. We could give the floor to our researchers and present these highlights of their past work. We could have invited a number of representatives of the partners of the healthcare system, asking them how they see the added value, if any, of KCE in the system. And we did nothing of that. Although it is certainly meaningful and legitimate to applaud the visionary initiative and energy of the founding fathers of KCE, and some of them are present here in the room, we thought it might also be interesting to look forward instead of looking back. Imagine your neighbor, your friend, your father-in-law being diagnosed with a prostate cancer. And not a very big, not a very aggressive prostate cancer, but he's just 66 years old and in a relatively good shape. He's in a good general condition. And he turns to you as he knows that you work at the KCE, just to ask your opinion. You're happy to say that just recently KCE completed a guideline on the subject. And that, in his case, probably the best thing to do is nothing. Well, not really nothing, but active surveillance. But no surgery, no chemotherapy, no radiotherapy, no high-intensity ultrasound treatment. And then what we see in reality, in real life, is that very many of these friends, neighbors, fathers-in-law, still and eventually end up with surgery, with radiotherapy, with more aggressive treatments. And mutatis mutandis, this applies to very many of the evidence-based recommendations and advices. Let's think of the pacemakers, of the transcatheter aortic valve implants, the radiographies for ankle sprain, the drugs for osteoporosis or Alzheimer's disease. Why is that mismatch between our supposedly rational, evidence-based advices and what the patients or the caregivers, the public, really seems to want and to appreciate? Of course, in a number of cases, the financial incentives are misaligned, pushing people to the, according to us, wrong choices. That's the easy one. But not the whole story. More often as not, these, what we call perverse incentives, are not present, and there is no conflict of interest, and still we see the same prevailing mismatch. The problem is certainly not limited to our work at KCE. It is familiar to whoever is active in health promotion or public health. But if persistently people ignore or even reject the messages of researchers and policymakers, we as an institution are at risk of becoming just an expensive waste of time. So there are certainly enough reasons to have a profound reflection on this question. An anniversary is a good occasion to have that sort of introspective reflection. Reflection on one's own functioning. And to do so, we indulged in treating ourselves, and hopefully you this afternoon, to an intellectual present. We asked 3 prominent speakers to help us framing the problem and hopefully bring also some elements of solution in this problem with many different dimensions. And we searched these speakers outside the boundaries of our own little country in the hope to open up our minds in order that we broaden our perspectives and also learn from how they see and approach these questions. At the end of the afternoon, we have asked Professor Yvan Denier to wrap up the different lessons learned during this afternoon and to give us an impulse or a challenge for the next decade. And she will be active during the whole afternoon, drawing up a mind map in order to help us remind at the end of the afternoon what we have heard and how we can think this together and project it to the future. Considering that we have received almost 400 registrations for this symposium, we can safely conclude that we are not the only ones to look forward to this type of intellectual threat.